Duly noted, 3/15/2013. Dr. Kathy Dooley. I'm a doctor of chiropractic. I also have a Master of Science in Clinical Anatomy, as well as I'm working on a Master's in Acupuncture and Oriental Medicine. One thing that I've noticed as of recent, because my attention has been brought to it with my neurokinetic therapy training, is the compensation of toe grippers, the muscles that flex the toes, for hip extension, the activation of the hamstrings and glutes. Not quite sure why we depend on these, maybe because we're closer to the ground and feel proprioceptively like we want to grip and be stable. But it was definitely National Toe Gripper Day yesterday in the clinic, and I've had to correct a lot of people on this, including myself. I tend to grip the ground with my toes rather than activate my glutes and hamstrings, much larger muscles. What these things have in common is that they're all on the posterior chain. Your flexors of the toe that go all the way down to the distal part of your digits are actually deep within your calf. They're also at the bottom of your foot, the ones that flex all the way to the interphalangeal joint of the great toe and the proximal parts of the toes. Those muscles are deep within your arch as well as on the bottom of your foot. Maybe for you, you don't see toe gripping, but you feel plantar fasciitis. That can also be involved with this. I see it on the swing, I see it in a squat pattern, and I also see it in a deadlift pattern. What you want to make sure that you do is look for this in yourself and definitely look for this in your patient. Put them through a basic hip hinging pattern where you're having them just stick their pockets backwards and look for them to grip the ground with their toes. For me on a swing, it'll happen. You can sometimes see me grip the ground with my toes. Now I have to consciously tell myself to activate my glutes to give a good quality hip extension. The treatment for this can be pretty simple. Roll out or active stretch the muscles that grip the toes. You can do that with a water bottle for the muscles on the bottom of the foot. You can freeze a water bottle, it actually feels pretty good. Or you can use a golf ball or lacrosse ball to roll out, get these muscles to get a little circulation, to get them to chill out a little bit on the fascial level, that saran wrap that covers the muscles. And then you can take a foam roller or a softball, and you can roll out the calves. Now, the gastrocs and soleus are muscles that are more superficial, they're larger, and they point the toes. The flexor digitorum longus and flexor hallucis longus also have the ability to point the foot forward, so they can help with that, but they also grip the toes to the ground. Since we don't actually live on soil much, we usually live in shoes, these muscles shouldn't be as active as they are. We should be using our glutes, and we should be using our hamstrings. After you roll those out, you can do active stretches. You can write the letters of the alphabet with the feet, getting the toes to kind of relax and increasing ankle dorsiflexion and plantar flexion without gripping with the toes. Then you put yourself into a hip hinging pattern, whether it be with squats or deadlifts. Squats are more quad dominant. A hip hinge is going to be more hamstring and glute dominant, but you can do swings, you can do deadlifts, you can do different patterns that help you to engage and teach the glutes how to act, how the hamstrings how to act, and decreasing the incorporation of the muscles of the deep calf from trying to take over for the glute and hamstring. Keep an eye on this on yourself. It has huge carryover into your life, whether you're picking up your groceries, picking up your kids. That's a hip hinging or a squat pattern, and you might be gripping the ground with your toes to try to help out. Roll it out and then incorporate the pattern, reinstituting that movement pattern that's a lot more clean. You'll notice a big change in the way your back feels, less pain in your arches, and less tight calves. If you have any questions, email me at drkathydooley@gmail.com. See you next time.